Hello and welcome to 12 to Your Health. I'm Roxanne Evans. Dr. De Silva is off this week. All right, just the phrase spine surgery used to strike fear in patients because it meant lots of pain, long periods of recovery, and time away from work. Well, for many patients, that's just not the case anymore due to the emergence of much less invasive back surgery. Here to talk about these new techniques and their advantages is Dr. Bolahan Okabadejo, Director of the Comprehensive Spine Institute of New Jersey at Jersey City Medical Center. So, Dr. Bo, welcome to the show.
Thanks for having me.
Well, listen, let's first talk about what exactly are you doing today differently than how it's been done for so many years, decades in the past?
In the past, doctors used to make very large incisions to accomplish spine surgery, whether it be a discectomy or a fusion. Now we have minimally invasive techniques where we use a lot smaller incisions. We work through tubes, and we get a lot more work done through these very small portals.
Okay, so the first question most patients must say to you, well, what are the benefits? What outweighs the pros and cons here?
The major pro is that we make very small incisions. We don't have to cut through a lot of muscle. We're able to accomplish the work that we need to, whether that be a discectomy or a fusion, and get patients back to their regular lives very quickly because we're cutting through a lot less muscle and skin.
Okay, so give us a for example. You're saying they get back to work much more quickly. How so? How many weeks or are we talking about days or even months here? What are we looking
I had
at?
a patient actually about a month ago, a 36-year-old banker who'd been having pain, radiating pain down his left leg. I performed the surgery. It's outpatient. He went home the same day. And he was back to work within 2 weeks. So,
2 weeks?
Absolutely.
That's pretty incredible.
Yes.
Okay, so you can see why people are opting to do this. So up until now, most people probably viewed spine surgery as something, I mean, and I even know, even from my own relatives, they would stay away from it, shy away from it.
Yes.
What are you hearing now?
I think now patients are a lot more confident. We educate patients a lot more on our website, CSISpine.com. We actually have animations where patients can go in and get educated and learn about the procedures. I think knowing what they're getting into and with the advances in technology, I think patients are a lot more confident and comfortable, and we're doing a lot more.
Okay, so on these models we have right here, can you show us minimally invasive spine surgery?
Absolutely.
Exactly what would be done? Because, of course, show and tell is much more important.
Absolutely. So the most common procedure I do is called a microdiscectomy. So I'll make about a 2-centimeter incision on the skin, dock tubes onto this part of the bone, which is called the lamina. I'd cut through the bone a little bit and make my way down to find the nerve, retract the nerve inwards, find the disc, remove the herniation, and pretty much I'm done. That usually takes me about an hour or so.
This can be done in an hour. It used to take you how long?
If you do it open, usually that takes about an hour and a half to 2 hours, and it's just a lot more cutting. If you go open, you have to go through the midline, take down muscle on both sides, and just do a lot more work just to get that same job done.
So you're saying you don't have to cut all the way into that bone. Is that what you're
I'm saying I take a lot less muscle down, and I'm visualizing my work through a microscope and a tube. So it's a lot less dissection, and I can see exactly what I need to and get the same work done.
When is spine surgery absolutely necessary?
It's necessary when your pain is to a point where you can't live with it anymore. Most patients, I'd say maybe about 10 to 15% of patients I see actually need spine surgery. So if you've been having pain, you've had physical therapy, you've had injections, you haven't gotten better, and you say, I cannot live with the pain anymore, and I see something that I can specifically take care of, that's when you need spine surgery.
Well, Dr. Bo, you just talked about one of your patients, 36 years old.
Yes.
What about the older patients, patients who typically are at risk for any type of surgery?
Right.
Are you still practicing this on them?
Absolutely. The most common pathology in older patients is called lumbar stenosis. Usually that's a multi-level disease where you have compression at different levels. Usually that's a little more complex and you have to do a little more cutting than with the minimally invasive. But there are techniques that we can use where we can work through the tubes and just undercut these bones, the lamina, and get the same work done. So it is an option for those patients as well. Another procedure is called kyphoplasty, where patients have fractures in these bones. And we make very tiny incisions on the skin and inject cement into the bone, and that gets patients up and about a lot quicker. So that's something
Cement?
that absolutely, yeah.
Cement?
Yes.
What type of cement? I mean, you know, if you told me you were going to inject
Right.
cement in my back, I'd be
Yes.
like, all right, Dr. Bo, hold on.
Right.
Wait just a second.
Well,
What do you mean?
Calcium phosphate. So if you have a compression fracture, that means this bone may have broken down because your bone is brittle. You have osteoporosis.
Okay.
So we have this procedure where we dock 2 small trocars, and through these we insert a balloon, inflate the balloon, to occupy the space, and then just put cement in that space. What that does is it stabilizes the bone, and patients get up and about a lot quicker. I've actually done a 95-year-old with this technique, and they did very well.
And same recovery period,
Same
2
recovery.
weeks?
No, it's actually quicker.
Oh, even quicker than
Absolutely, yeah.
Dr. Bowe, fantastic. We're great to hear these types of techniques on the medical scene.
Thank you.
Thank you so much for coming in.
Thanks for having me. I appreciate it.
Thanks, Dr. Bowe. Now